Jennifer Sanesi. You're watching News 24 Live. I'm joined in studio by our resident doctor, Dr. Darren Green, and today he's answering your social media questions. Hello.
Good morning.
Today we're talking about fever in children. Now, a lot of people have been asking what to do if their kids have a fever. When should they go to the hospital? When should they see a doctor?
I think a lot of people just don't realize that fever is actually a good thing.
What?
It's good. It tells you that your immune system is actually working. The problem comes in is if you're really, really sick and you're being invaded by a foreign body or a bacteria or an organism with the ability to cause disease, and your body doesn't recognize it and can't launch an attack on it. How the immune system works is, firstly, it needs to identify an invading organism. When it does that, it activates its different soldier cells and then sends them to the site of infection to actually go and engulf them, in other words, surround them, bind to them, and then cause a sequence of events that leads to killing the bug. So, fever actually occurs only once that process has actually happened. In other words, when there is an attack from your immune system on the bug.
So fever is actually good.
Well, it signifies that your immune system's working. The complications, however, of prolonged fever and fever that is uncontrolled can lead to other health complications, things like febrile seizures in children. So children with persistently high temperatures can lead to having fits, basically, or convulsions at home. So what parents are obviously concerned about is we need to get it down as quickly as we possibly can to prevent that happening, because those seizures occur normally up to the age of about 5, 6 in childhood. So to get the fever down is a priority, because we feel unwell when we have a fever. We start shivering, we actually feel cold before we feel hot. You can start sweating and really feeling weak and just rather lethargic. A sense of malaise then kicks in and so forth. And then we're bedbound. So people need to get rid of the fever quite early to feel better.
How do you get the fever down?
Well, there are different ways. There's some practical tips for parents out there, and that would be, firstly, measure the temperature. And if you are using your hand or the palm of your hand to feel the child's forehead, rather turn your hand around and use the other aspect of your hand. Then you'll feel, obviously, how hot it is in relation to yourself and to the surroundings. Then you can act initially first by unclothing your child. Your child might be dressed too warmly as part of the mild cold or flu that they have. And then obviously you can expose them to lukewarm water or tepid bath, where you put them into the water and allow the temperature to self-regulate and come down. A lot of parents' first port of call is to give their children a suppository. If they're nauseous and vomiting, suppositories are quite useful for antipyretic agents. Those are agents that lower, obviously, the temperature. And syrup, obviously, can be used if they're not vomiting or not nauseous. And you get a whole host of antipyretic agents, ranging from paracetamol to the anti-inflammatories. We tend to steer away from the anti-inflammatories in young children under the age of 2 years, remembering also that anti-inflammatories can also cause gastritis and cause a bit of inflammation of the lining of the tummy, especially if they take the medication on an empty stomach after not ingesting food.
Now, I've heard that if you have a fever, you should try and sweat it out. You should maybe dress even more warmly and try and sweat that fever out. Is that a myth?
It is a myth. A lot of people feel when they have a cold or a flu that, drinking something hot and a hot tea makes them sweat. It opens up the pores and they release toxins through the pores and so forth. Often it's like the sauna effect of getting into a steam room or a sauna, so forth. The problem comes in is this fever is not just a raised body temperature. It's telling you about what's going on a cellular level. So it's not going to go away if you make yourself hotter and hotter and hotter, and you could then lead to serious consequences. If the blood itself, the temperature within the system reaches a certain point, it has metabolic effects on the brain. So when you have a fever that's sustained, it can affect eventually the blood delivery to the brain, the delivery of nutrients, the metabolism of the cells that occurs on a brain level, and then you could have seriously altered level of consciousness.
Now, how long should we wait if we have a fever to see a doctor?
So I think firstly is the obvious cause of the fever. We must find the cause of the fever. So if it's dressing too warm, unclothe your child, for example. If it's a hot day outside and they're dressed inappropriately, let's start there. If there's an infection, what's the source of the infection? Is there a runny nose, a cough perhaps, or is the child fidgeting with their ears? And certainly, is there a rash accompanying the syndrome? Have they been in contact with anyone that's had a viral infection or influenza or any form of other infection like chickenpox, for example, or mumps even at school. So have a look at associations first. And obviously we then treat accordingly. When the fever becomes more frequent, if the temperature is sustained and is not responding to simple analgesics or simple paracetamol, one would want to notice then obviously 3 or 4 spikes a day that are getting progressively worse. You need your child examined to find the source of the fever and then treat it accordingly. A lot of moms and dads want to know when should they see a doctor and when should they start antibiotics for their children that have fevers. And what we need to be aware of is drug resistance. Far too often we find that doctors prescribe antibiotics because it's the expectation of the parent. What we need to look at, however, is what are we treating exactly? Is it a viral infection? Because then antibiotics aren't indicated. Or is it a bacterial infection where, it would then be appropriate? So how do we decide whether an infection is viral or bacterial? Well, clinically we look at the course of the disease. How many days has it been there? Which specific system is involved? Are there certain disease or clinical syndromes that point more to a bacterial cause or not? And then definitively one can do a blood test. When you're not sure, always even request your doctor to do a blood test to be sure, so that you don't assist in the process of antibiotic resistance. And in that we would then look at the white cell count, which would be really, really high and raised in a bacterial infection, and other markers like your CRP counts and what's called a procalcitonin level. So there are ways of differentiating the two, and certainly don't feel scared to ask your doctor, are these antibiotics absolutely necessary?
Dr. Green, it's always a pleasure.
Thank you.
If you have any questions for the doctor, let us know what those are in the comment section below, and we'll see you next week.